we now today have the proof that the numbers in Victoria, the outbreak in Victoria, the mismanagement by the Andrews government has now spread to New South Wales. We've been suspecting this for a few days now, and finally today we had the confirmation. New South Wales Health Chief Medical Officer Kerry Chand and their contact tracers have confirmed that the outbreak in southwest Sydney originally came from one single individual who was infected from Melbourne. This just shows that the Andrews government, Daniel Andrews, Victorian Premier, his decisions that he made in how he controlled the outbreak have put all of Australia at risk. Let's look at just how bad the mismanagement has been from Daniel Andrews. We know that instead of accepting help from the ADF, he instead chose to use cheap private contractors at those hotel quarantine sites. We know that instead of using the ADF, it was offered repeatedly and repeatedly. He just chose not to accept their help until the very last minute. He allowed the Black Lives Matter protests to go ahead, and that sent the message that social distancing was no longer necessary. But tonight I can tell you that Victoria's management of COVID-19 is even worse than what we already know about. I've confirmed that the Victorian Health Department has been turning people away from getting tested, and even people who've come in close contact with confirmed coronavirus cases. This is not only clearly extremely risky, but it's also against the official federal government health advice. On the 25th of June, that's just a couple of weeks ago, McDonald's was advised of a confirmed case of COVID-19 at their Mill Park McDonald's in Melbourne. They did the right thing. They immediately closed the restaurant for cleaning and identified 26 employees as close contacts. They did this following the official guidelines issued by the Victorian Department of Health and Human Services. Now, the staff member who tested positive luckily didn't have any contact with customers, and their close contacts at McDonald's, fellow staff members, were identified through rosters and CCTV footage. They identified 26 people and told them all to self-isolate for 14 days and to get tested. But when the staff went to get tested, they were turned away. They were told that even though they'd been a close contact of a positive infection, they could not get tested unless they had symptoms. A McDonald's spokesman confirmed this. They said, "While we respect the department's advice as the experts managing this difficult situation, our preference remains that any potential close contacts should be instructed to be tested." McDonald's has a very productive working relationship with the Victorian Department of Health and Human Services and has continued to act above and beyond the department's requirement out of an abundance of caution. Now, just for clarity, the official federal government health advice does state that you should get tested if you've been in contact with a positive case, even if you have no symptoms. This is what the advice says. It says testing is important for anyone with symptoms, and particularly if any of the following apply to you. You have been in close contact with someone diagnosed with COVID-19 in the past 14 days. So once again, there's been the Black Lives Matter protests, which sent the wrong message on social distancing. There's been the use of the cheap private contractors to protect those in hotel quarantine. There's been the turning away of the offer of help from the ADF. And once again, now Victoria is acting against the official advice by turning people away from getting tested who've been in close contact with an infected person. And we know that people can be asymptomatic, that they can contract that virus and not have any symptoms. It's no wonder the virus has taken hold in that state with such a high rate of community transmission. Now, just important to note, the Victorian Department of Health has not responded to our questions today for comment. I interviewed Health Minister Greg Hunt on my show on Sunday night, and he was clearly already concerned then that the Victorian outbreak was responsible to the spread to New South Wales. Have a listen. And do you expect we will find more infections have spread to those other states?
Well, at this stage, we have obviously one cluster out of the Crossroads Hotel in Sydney. That is a serious cluster, but there is an extraordinary job of tracing going on. But the messaging to anybody who's been there between the 3rd and the 10th of July is to isolate and to test. More generally,
do you think that cluster was linked to Victoria?
I understand is. My understanding is that New South Wales Health is getting very close to identifying the original source. I am hopeful and confident that within 24 hours they will be in a position to identify that source, and I'll always wait for them to confirm and therefore to announce. But my advice is that they are very close to having a definitive source.
And medical advice sent to Chief Health Officer Kerry Chant last night, as I said earlier, has linked a unique Victorian strain of COVID-19 to Sydney's Crossroads Hotel, where an outbreak has occurred and has infected upwards of 30 people. The State Chief Health Officer has stressed her concern about the situation at a press conference today.
I'm also very concerned about areas where we may have had a number of visitors from Melbourne in particular and the Mitchell Shire. And so particularly the coastal suburbs and our border communities, we need to have high rates of testing so that we can prevent if there's been any seeding, that we can mop it up and block those chains of transmission. And I think the Crossroads highlights that we are not going to gain control of this if we don't have the community on board.
The Australian has also today reported that Victorian health authorities have confirmed a link between 2 people in the public housing tower cluster and the Black Lives Matter protest in Melbourne last month. The battle to contain the outbreak in Victoria and now nationally continues.